Region Stroke and Neuroscience Hospital offers care in the field of neurology, neurosurgery, and other specialty areas of medicine, including cardiology, nephrology, orthopedics, endocrinology, psychiatry, and critical care. Our intensive care unit is supported by a team of physicians led by a US-trained critical care specialist and intensivist who was a former medical director of the Neuroscience Intensive Care Unit at Novant Health Forsyth Medical Center in Winston-Salem, North Carolina, and member of the Society of Critical Care Medicine, USA. Other specialists that work in the ICU include anesthetists, a nephrologist, cardiologist, respiratory physician, neurologists, and neurosurgeons. All these people come together to form a multidisciplinary team of specialists in conjunction with trained ICU nurses, dietitian, occupational, physical, and respiratory therapists. The ICU has 3 specialized neurology and neurosurgical intensive care units, 3 specialized cardiac and coronary intensive care units, and 7 specialized general medical intensive care units, bringing to a total of 13-bed intensive care unit. The unit is fully equipped with technologically advanced multimodality patient monitors supplied by General Electric GE, mechanical ventilators, and non-invasive ventilators. We have an on-site and fully equipped medical laboratory and radiological unit supported by trained medical lab scientists, radiographers, and radiologists. Our labs function 24 hours daily and help us to make timely patient care decisions without lapses. We also have a fully functional in-house hemodialysis center where we can dialyze our patients if need be. The dialysis unit is coordinated by our consultant nephrologist and kidney specialist. The ICU is equipped with a mobile GE digital X-ray that enables us to take X-rays of patients in the ICU and immediately have an available image within the unit to review and quickly make decisions. Ultrasound machines that help us to perform bedside ultrasound, including echocardiography, venous and arterial Doppler studies, transcranial Doppler studies, abdominal ultrasounds, etc., without the patient leaving the ICU. There is an adjoining operating room fully equipped with neurosurgical operating microscope and C-arm that serves both the hospital and the patient in the ICU who may need surgical procedures. The cardiac and coronary unit is supported by a cardiologist. We have affiliations that support robust telemedicine programs through which we work with several physicians trained in the United States and the United Kingdom who provide second opinion specialist consultations in the areas of infectious diseases, cardiology, nephrology, neurology, and neurosurgery if requested by families. Our ICU is also supported by an in-house clinical pharmacist who ensures that the right drugs are delivered to the patient at the right amount in the right way. We are able to take care of patients with neurological conditions, including those who are unable to breathe on their own and such as continuous uncontrollable seizures, status epilepticus, large strokes, brain bleeds, brain swelling, myasthenia gravis, and Guillain-Barré syndrome. We also support neurosurgical patients and post-operative neurosurgical patients, including brain tumor patients and patients who have undergone complex brain surgeries such as aneurysmal clipping. We provide support for medical patients with renal failure, heart attack, pneumonia, multi-organ failure, liver failure, kidney failure, and other serious medical conditions that warrant a stay in the intensive care unit. All of our patients are connected to a central monitoring system. Their laboratory investigations, radiological investigations, doctors and nursing charts are linked to the central electronic monitoring and medical record system. This allows every doctor and nurse to immediately view patients' results, understand what has been done for each patient, and make decisions in real time. The electronic medical record system provides an advanced technology that reduces errors. This system is modeled in line with the best practices in intensive care units in the United States and Europe. We work as a destination ICU, which means that we provide support for all hospitals whose patients need ICU care. For all patients who may have started their treatment in other hospitals hospitals who now require intensive care management in an ICU, our team of physicians will work together with the patient's referring doctor to transfer them here for ICU management. Our ICU boasts to provide the same level of care as in the US and UK to save a life when the patient's condition has become critical. We have an emergency medical service with 2 fully equipped critical care ambulances that can pick up a patient within the region and outside the region. These ambulances are equipped with respiratory support and transport ventilators that make it possible to safely transfer patients from one point to the other. Our ICU nurses have received certifications in intensive care and continue to receive training from experienced ICU nurses in our affiliate hospitals in the USA. Our respiratory therapists work 24/7 in the ICU to ensure that our ventilators are well managed and the physicians' orders are carried out. In addition to routine ICU care, procedures and investigations that are available in our ICU include hemodynamic monitoring, central venous line placement and monitoring, continuous video EEG, arterial line placement for invasive blood pressure monitoring, external ventricular drainage, and intraparenchymal pressure placement and monitoring when needed. We invite you to experience the services offered at our intensive care unit, aimed solely to provide a life-saving opportunity for patients who require critical care management. For more information, call the numbers on the screen, visit our website, or email us.